Donc, on repasse en français pour la présentation suivante, qui est la présentation
So we're moving back into French for the next presentation, which is from the Visio-Mel consortium, which brings together members from the French Society of Pathology, of Dermatology, the group of cancer workers and pathologists. It is going to be presented to us by Dr. Frédéric Staros, who is a member of the SFP and president of the Pathologists Professional Association. Good afternoon, and thank you for the presentation, and thank you HDH for inviting me to present our project. So some of my slides have already been shown, so I'm going to have to do this in a different way. So the data challenge that I want to present to you has been developed by two scientific societies, the French Society of Pathology and the French Society of Dermatology. This is a data challenge that brings together a number of different specialities, and the SFP is the Pathologists Society is not a scientific society, but seeks to improve data. So we've developed a consortium, which is called Visio-Mel, which brings us together, and it's Visio-Mel that's carrying this project. We're not working on our own, but we're working with a database that's been developed. I'll talk to you about this a bit later. And we're supported by Dr. Datak, by a lawyer's practice specialist in data and GDPR to support us around data protection issues. We also have support from the BPI and also the BMS laboratory and Pierre Fabre in terms of funding. So our focus is on melanomas and the possibility of predicting the possibility of melanomas reoccurring. So Akat has said everything very quickly in terms of my presentation. What you just need to know is that I live in Brittany, a long way away, up by Quimper in the far west corner of France. I lead the Visio-Mel project for the Pathologists Association. So here are some pictures that you might not find very easy to handle, but melanoma is a malign tumor developed from melanocyte, which develops in the epidermis and affects everything that can be nucleic acid and affects therefore the DNA. It is limited by environmental factors, for example, sunlight exposure and UV exposure. Of course, there's an anti-melanoma day every year, which encourages people to put sun cream on, which respects the environment. It's very important, but this needs to be used to protect the skin. Also, there are factors linked to the types of skin and also genetic predisposition, which is more of a complex area. Melanoma are only the third most frequent cancer, but it's increasing, particularly with people with light skin. And we're seeing this in particular areas, particularly around mountain areas where there's an exposure, and this is a public health issue. So this affects a very localized melanoma and is dealt with through surgery. Some melanomas can have a metastatic evolution, and then there needs to be immunotherapy and targeted therapies that are have been recently developed, but have shown themselves to be very effective. So here's some images of melanomas here. These are the tumor cells that you can see, and they are coming into the epidermis level. So one of the key issues around this is the ability to predict whether it's going to reoccur or not in patients. For the moment, we have a number of factors that make it possible to have some levels of prediction linked to histological aspects of the duration of the cancer. While these factors have a statistical value and they're very robust, but they're not totally reproducible in terms of data. And there are some that present, some melanomas that present a very good prognostic that do recur, and others that don't. So what we're wanting to see is this, through this data challenge, if we can develop algorithms that will be able to predict the recurrence rate of cancer so that we can focus on patients who are in particular at risk of recurring melanomas. And we want to use algorithms to look for targeted genes also through this process. So these are the key goals: predicting the risk of recurrence between 0 and 5 years. This is the period of time that we're aiming for. And we're also looking for the mutational status of the tumor, which is linked to targeted therapy. So we've been fairly ambitious in terms of the number of patients. We want to include about 3,000 patients. In order to find 3,000 patients with melanomas, we've worked together with the SFP-Mel database, which has been in place since 2012. And it brings together 49 dermatological centers, and there are either 43 dermatological centers and 6 cancer centers, and it has clinical data and pathological historical data in this database. So it really is a very precious resource for identifying patients that would be useful for this study. For our study, we've selected patients from 2012 to 2016, since this is a retrospective study. We have patients with a localized development of melanomas. We're using SFP-Mel. We're going to develop basic clinical data: age, sex, histological factors, prognostic, the width of the lesion, and other histological data through NAPAD structures that store these. We're going to get their microscope slides and analyze this. So there'll be a mix of clinical data and histological and microscopic data involved. Okay, so now it's over to somebody else, I think. So now the molecular data will also be included, but this mutation data can be complex because between 2012 and 2016, these were not systematically included, and they were mainly included for poor prognostics. So this will be a second phase of the work. So in terms of the study, we started in January with creating the consortium. We are currently setting up agreements with the clinical centers and looking for patients who agree to share their data. Then we're going to collect the clinical data of these 3,000 patients throughout the work of the project manager who we've hired for this data challenge. And we hope we're going to stick to this deadline. And then we will set up agreements with the different organizations so they can send us their Microsoft slides and we can digitalize them. Once that has been done, this database will be linked. The histological and clinical data will be linked within the database very carefully and will be passed on to the Health Data Hub, which will then be responsible for distributing the data through the Driven Data Challenge platform that we've selected. It's an American platform which is able to reach data scientists around the world. The first data challenge performed by the SFP involved data scientists from a whole range of nationalities, and we thought that would be very useful. Once all this data has been put on the Driven Data platform, they're going to check that it's all correct. And then there will be the proper challenge period, which will last 7 weeks. All of the data scientists will be able to use the data on the website and the IT resources made available by Driven Data. In a second phase, they will then determine the best algorithms for identifying the risks of recurrence of melanomas at an initial localized stage. After that period, we'll organize a special event which will bring together the French Society of Pathology and the French Society of Dermatology to award the prize to the best algorithms and competitors. The data will then be made available by HDH in an open source format for medical use. So if we summarize this, the 3,000 patients will be segmented. So we have 3,000 patients who will be a bit biased in terms of the normal recurrence rates, because about half of them saw recurrence and half of them didn't. So we'll have a training test of 1,200 slides and then a test with 600 slides and then a validation period with the remaining 1,200 slides. All of this data will be made available for 7 weeks on the Driven Data platform. The prize will be 25,000 euros for the best algorithms, but if the algorithms are powerful and the competitors really manage to improve our treatment of these melanomas, and it will then be made available on the Health Data Hub. I'm afraid I don't have any final slide, but thank you very much for your attention. Thank you very much, Frederic. If there are any questions in the room here, we can pass the microphone to you. Or if there are any questions online, otherwise, please feel free at this point. Otherwise, we'll move on to the next speaker. No questions? Yes, sorry, there is a question. Just in terms of the data sharing platform, it's just a data sharing platform or also a computing platform? Do participants need another computing structure or can they do everything on the platform? No, they can do everything on the platform. They can do everything on the platform. Any other questions? Yes, I just wanted to know whether data laws make it possible to produce a commercial product. The algorithms will be open source. We are requesting that all algorithms will be open source, which doesn't mean it's not possible to develop a commercial product, because probably the first algorithms are going to have to be improved. I think if we have an algorithm that is immediately applicable for a therapeutic application, that would be very remarkable. So a private company could then improve this, or the first company that developed it could then improve it. But the data that's in open source could open up opportunities for other algorithms, which could then be developed in a commercial direction. I think that's one of the purposes of what Health Data Hub is trying to do. Because sometimes commercial use is prohibited. No, that's not the case here. It's not prohibited, but with the first data challenge, which was organized by the SFP, competitors were able not to open up the algorithm for open source if they refused the prize. But here we are requiring the open source sharing, and the Visio-Mel database is requiring this. And they want to know that if there is a commercial development, that they could know about this and cooperate with this. So we are actually we are requiring people to share their algorithms on open source.
Thank you, Frederic. We've got an online question. Does the online platform operate with GPUs? And the answer is yes, the platform will operate with GPUs that will be made available to the competitors. Frederic says, I don't know, but Agathe says, yes, that's what you said.